Here we can see some risk factor for osteoporosis. So first one, advanced age. So estrogen and testosterone deficiency increase the bone loss. So osteoporosis, definitely you know that bone loss. So what are the factors that can aggravate, lead to osteoporosis? First one, we said our advanced age. Gender, female is more affected than man. Family history, medication use. What kind of medication? Like steroid, glucocorticoids, anticonvulsant medication, thyroid supplement. The patient who has a history of cigarette smoking, excessive alcohol consumption, eating disorder, low body weight. Low body weight means less than 127 pounds. Also, parental history of hip fracture. Ethnicity, it is most common in Caucasian. Calcium and vitamin D deficiency. Excessive phosphorus, phosphate, and or protein intake. So if you take too much phosphate or too much protein, it also can cause osteoporosis. Immobilization, sedentary lifestyle. So if you do exercise or weight-bearing exercise, it helps you to prevent or slow down osteoporosis. And what next? Next here, clinical risk factor for the fracture. What are the common cause of fracture, right? This is here advanced age group, or patient has a previous history of fracture. So the person who have a previous history of fracture, they have a chance, one of the risk factor again fracture. Glucocorticoids, so steroid therapy, history of cigarette smoking, excessive alcohol consumption. Definitely you get confused, more chance to fall, and if you fall, chance of fracture. Low body weight, also. Parental history of hip fracture. Rheumatoid arthritis. So what are the disease can lead to the fracture, or what disease accelerates the fracture if you have a history of rheumatoid arthritis? Secondary osteoporosis like hypogonadism or premature menopause, malabsorption, chronic liver disease, or inflammatory bowel disease. All of the factor or the clinical risk factor for fracture. Here one question. Which patients should be need to exam for osteoporosis? A 60-year-old man with a rheumatoid arthritis. Few minutes ago, we saw rheumatoid arthritis, one of the risk factors, can cause osteoporosis. So it is the answer. Let me read rest of three. 50 years old Caucasian man, 65 years old man who is otherwise healthy, 62 years old post-menopausal women. So explanation said, routine scanning for osteoporosis is not recommended in men unless risk factor such as rheumatoid arthritis. So the women who need to the scan, so the women in recommended starting at the age of 65, if right. So in this question, we do not see 65 women, 65 years old, but men, not women. If the risk factor are present in female, scanning is recommended at early age. So we do and check, or scanning is usually performed by bone minerals density, usually a dual energy X-ray absorptiometry, shortly called DXA scan. What next? Next here, which finding suggests that patient may be abusing alcohol? Macrocytosis, right? And also tremulorousness or hypertension. Why it is the correct answer? The person who are alcoholic, they have a chance to develop vitamin B12 absorption gets slow or impairment. Deficiency of vitamin B12 can lead to the megaloblastic anemia. Mega means bigger. So macrocytosis, RBC, get bigger, right? So this is the basic explanation. The person who take alcohol abuse, they have a chance to develop megaloblastic anemia, where the red blood cell is macro, means bigger, cytosis, and also hypertension. Second question, rhinophyma, hypotension, or peripheral neuropathy. Alcohol abuse usually do not produce hypotension for long term. At the very beginning causes hypotension, but later hypertension. No record found peripheral neuropathy, but maybe chance of rhinophyma. Telangiectasis, flat effect, and thyroid dysfunction. No evidence say that. Hepatosplenomegaly, murmur, and osteoarthritis. What is their explanation? Findings that suggest the trigger examination to suspect a alcohol abuse in a patient are tremor, hypertension, rhinophyma, peripheral neuropathy, telangiectasis, hepatosplenomegaly. So when you choose the answer, you have to check which one. All of three can cause, not only one. Maybe one, rest of two is not a cause. In fact, he may not exhibit any of these symptoms or still abuse alcohol. The symptoms listed on the other choice are not specially associated with alcoholism. Macrocytosis is common in alcoholic because there is a higher rate of vitamin B12 deficiency or folate deficiency, and both can produce macrocytic anemia. But next question. A pregnant mother or pregnant patient in her first trimester is found to have a chlamydia. So chlamydia is a STI or STD. So how should this be managed? What medication is good? Erythromycin, ceftriaxone, doxycycline, or do not need to treat the first trimester? So correct answer is the azithromycin. So in pregnant client, chlamydia is treated with azithromycin. So we need to learn it for board exam. So if anybody is pregnant and also chlamydia, treated by erythromycin. So erythromycin is a safer medication. If the patient were not pregnant, then we treated by doxycycline. So both is important to know. Would be the preferred choice. So drug of choice, doxycycline for chlamydia if non-pregnant. If pregnant, we switch to erythromycin. Erythromycin is given as a single 1 gram dose. Amoxicillin 500 milligram orally TID for 7 days is an acceptable alternative in the patient unable to take the erythromycin. This patient should be scanned for STI now. If all STI again before delivery, the patient should be advised to report the detection of STI in OBG or GYN on for that they may be scanned later. It is common for pregnant patient be reinfected before delivery. So what we learn from here? We learn if mother are pregnant, need erythromycin for chlamydia. If non-pregnant, doxycycline. Next question here. So we can say, question said, Hasselbeck triangle forms in the landmark. So Hasselbeck triangle. So we can see the picture, right? This area. This area is bounded by one of the rectus abdominis muscle and this side inguinal ligament, right? And this area we call Hasselbeck triangle. So direct hernia occur in this area. So you can see the picture here. It is indirect hernia. This is the direct hernia. So sometimes NCLEX would ask which area is more chance to develop indirect hernia, which area is direct hernia. So this area is Hasselbeck triangle. It is a triangular area. One side, this is the muscle, is called rectus abdominis. Here is the ligament, it's called inguinal ligament, and right. So and this is the triangle, which is called Hasselbeck triangle. So direct inguinal hernia occur through the Hasselbeck triangle. So this is the information we need to learn from here. Inguinal ligament, this one. Rectus abdominis muscle here. And epigastric vessel, this is the epigastric vessel here. Form this triangle. When there is a weakness in the floor of the inguinal canal, the hernia can result. And indirect hernia are the most common growing hernia in men and women. So this is the second point we learn. Inguinal hernia, most common growing hernias. This area is called groin. This area is groin. And right, so repair of this most common surgical procedure in performed in United States. What next? Next question. A 30 years old with type 1 diabetes and also pregnant. The routine diabetic need to scan. So should occur early, should occur 24 hours, or can be eliminated, and should be performed in third trimester. So why answer should be eliminated? Imagine a 30 years old female pregnant, do not have any history of diabetes, they must need to check blood sugar. But a lady or a patient or a mother who 30 years old and she already know them has a diabetics and pregnant, they do not need to check because they already know they have it. So on that point of view, the answer can be eliminated. But if she do not have diabetics, answer should occur early. So if a pregnant mother has been diagnosed with diabetes prior to pregnancy, there is no need to recheck for gestational diabetes. In non-diabetic mother, the routine time for scanning for gestational diabetes at 24 to 28 weeks. This has been identified as the ideal time because she is more likely to exhibit elevations in glucose at 24 to 28 weeks due to placental hormone that increase the insulin in sensitivity. And this is also a good time to initiate the intervention that will decrease the complication in the fetus associated with glucose elevation. What next? This question we say the two tests that can indicate the current infection with hepatitis B. Okay, so they said current infection, acute stage, hepatitis B. The two out of these, which two can indicate the patient have a active or acute hepatitis B infection? So presence of hepatitis B surface antigen and immunoglobulin M. This is the correct answer. Why it is the answer? Let me read number A. Presence of hepatitis B surface antigen. So this and this is same, but you see, and hepatitis B surface antibody, and here immunoglobulin M. So this is the correct answer. Indicate patient has an acute infection, current infection. Why? The earliest serologic marker that indicate acute hepatitis B infection is presence of hepatitis B surface antigen. It becomes positive about 1 to 10 weeks after infection. But usually before symptom onset, a positive immunoglobulin M indicate current infection as well. So this is the information we need to write it down. A positive immunoglobulin M indicate current infection. Presence of hepatitis B core antibody, I mean the presence of hepatitis B surface antibody and core antibody, number C, choice number 3, indicate hepatitis B infection, but I said not current, present or past with the certainly. It does not indicate the timing of infection, but maybe patient have a previously history of hepatitis B. Let me go next question. The most effective way to decrease neural tube defect to prescribe folic acid for a woman with a normal breaks, and how much is needed daily prior to becoming pregnant. So, you know, the neural tube defect, it is the one of the disease. We can prevent it if mother take vitamin B12 or folic acid, particularly folic acid. But how much mother need? The amount is 0.4 milligram. So supplement with folic acid decreases the development of neural tube defect, such as spina bifida and anencephaly. Folic acid plays an essential role in the neural tube closure. Neural tube development or closure take place in the first 4 weeks of embryo or embryonic life. US Public Health Service and CDC recommend that all women childbearing age must take 0.4 milligram folic acid daily to prevent neural tube defect. So what we learn from here? We learn neural tube defect are maybe spina bifida or anencephalitis. It can cause because of deficiency of folic acid. So if you give mother folic acid, it maybe baby will not develop with neural tube defect. But how much folic acid need? At least here 0.4 milligram. Next question here. Some cardinal feature of the patient who have Parkinson. So first of all, clinically, we can see the tremor and tremor at rest, resting tremor. We call pill rolling. So presenting symptom in 70% patient. So out of 100, 70% have a resting tremor or tremor at rest, or we call pill rolling. Bradykinesia means it makes the slow movement. Major cause of disability, this is the major cause, and also rigidity, increase the resistance to positive passive movement. So there are 3 cardinal signs. One is resting tremor, bradykinesia, and rigidity. A question here, which of the following are diagnostic criteria for migraine headache without aura? So migraine headache with aura or without aura. So what are the diagnostic criteria without aura? Correct answer is that pain lasts 4 to 7 hours. So rest of 3 are the criteria for migraine with aura, means pain is episodic during the headache. There are underlying neurological abnormalities maybe, or photophobia must present. But if patient do not have aura, we see the pain can last 4 to 7 hours. What is their explanation? There are no specific tests that diagnose the migraine headache. The diagnosis must be made based on clinical presentation of the patient and elimination of other etiology for the headache. In order to meet International Headache Society criteria for migraine headache without aura, the five criteria must be met. Number one, headache at least 4 to 72 hours. Number two, has two of these characteristics, like unilateral pulsatile quality, moderate to severe intensity, and aggravated by routine activities. So, has two of these characteristics must be present. And number three said at least one of the following occurred during the headache. What is that? Maybe nausea and vomiting, maybe photophobia or phenophobia, right? So patient complain when they go to the under the sun or because of sunlight, they have a sensitive to the sunlight, or phono, they like to avoid the sound. And number four, 5 or more attack have occurred with these characteristics. Number 5, there are no other reason of the headache occurring. So if you go, we can see. What next? A 40-year-old female patient present to the clinic with multiple painful red and nodule on the anterior surface of both legs. And she is concerned. And these are probably associated with her history of what? Deep vein thrombosis, phlebitis, ulcerative colitis, and alcoholism. As I told you, we gather some of the information in this PowerPoint. Every question is a new information that you must know. Every question has a particular specific information we are learning from here. So my patient has a ulcerative colitis. Ulcerative colitis patient has a skin manifestation, have a multiple painful red and nodule on the anterior surface of the body. So this is the information we learn. Ulcerative colitis is a gastrointestinal problem, but skin manifestation here. So these nodules describe the erythema nodulosum. They are more common in women aged 15 to 40 years old. They are typically found in a pre-tibial location and can be associated with infectious agents, drugs, systemic inflammatory disease like ulcerative colitis. So ulcerative colitis is a systemic inflammatory disease. So it has a skin manifestation as well. They probably occur as a result of delayed hypersensitivity reaction to antigen, and it is not unusual to found the polyarthralgia, fever, malaise that is proceed or accompanied the skin nodules. What next? Next, we can say this is our GIT, gastrointestinal tract. This is small gut, and this one is the large gut, or we call colon. In case of ulcerative colitis, affect the entire large intestine. In case of Crohn's disease, can affect any part of digestive tract from mouth 2 NRs. So here we can see loss of loss of what's it, and also general benign of the rectum or move upright. So next here, skin manifestation in case of ulcerative colitis, you can see the redness, red spot, erythema nodosum. Yeah, so this question says erythema nodosum. Painful redness nodule in case of ulcerative colitis. Next question here, a 45-year-old man who is in a good health present with a complication of pain in his left heel. And he stated that the first few steps out of bed in the morning are extremely painful, and he has no history of trauma. What is likely etiology of the pain? So 45-year-old man, good health, complain the pain his left feet. So go to this picture, we can see this is pain in the foot. So if we have a pain in this area, it's called plantar fasciitis. If pain in the tendon Achilles, it is called Achilles tendinitis. If pain in the base of the heel, it is called calcaneus apophysitis. Right? So the different view we can see. And if pain in the medial aspect of middle malleolus, it is called fibula fracture or fibula fracture. Is called, you see this picture, in this base of the ankle span, and this pain here is called bursitis, and also small joint involved phalangeal fracture. So go here and read the plantar fasciitis is an inflammation of ligaments in plantar fascia. The fascia is a thick white tissue that begins at the heel and extend under the foot of the toes. It supports the foot during the walking, and patients who are at the increased risk are the long distance runner or dancer, or people who are on their feet for long period of time. This can be treated with rest, ice, short-term NSAID, or some kind of tracing exercise, or steroid injection.